Good morning, everyone. Welcome to our live stream. My name is Paula Doucette, President of the New Brunswick Nurses Union, and I'm here today with Kathy Rogers, the Education and Research Officer with the New Brunswick Nurses Union. Together, we're pleased to present to you the report on nurses not being okay. I'm going to pass it over to Kathy and ask her to get right into the data and information that was collected from our members last year, midsummer. Kathy?
Good morning, everyone. It's my pleasure to share with you today the results of a study that I was honored to undertake for the New Brunswick Nurses Union last summer. In this study, New Brunswick's registered nurses and nurse practitioners were asked to report on how they are faring amid the now years of being short-staffed, on their shoulders bearing the outcomes of unrealistic and unsustainable work demands, of working longer hours with insufficient time off to recuperate, and of going home worried about their patients, their residents, and their clients. In short, the title of this report summarizes the answer to the question when asked, "We are not okay." However, registered nurses and nurse practitioners had much more to say. Often through tears and from an uncharacteristically high response rate, New Brunswick's nurses testified to feeling defeated, hopeless, and worn out, of being for too long unheard, disrespected, rendered of little to no value, and taken for granted. This has left them frustrated, tired, discouraged, worried, stressed, and hopeless, to the point that many spoke of being ready to give up, leaving their still much-loved profession altogether, utterly unable to continue in such conditions. Many also said that just sharing these feelings brought them guilt and grief. But they are at the point where they need to take care of themselves or others, because in current conditions, doing both is increasingly impossible. Nurses' honest and heartfelt words express a cry out to be heard and for action to be taken to turn things around before it is too late. Clear in the words of New Brunswick's registered nurses and nurse practitioners is that they care deeply about their patients, residents, and clients, and about the integrity of the healthcare system that is supposed to be working better than it is. Woefully, 91.73% of survey respondents from their frontline and experienced vantage points report that over the past 3 years, the quality of health care overall is worsening. And mostly to blame is the lack of action on the labor shortage and resulting unmanageable workload. The now dangerous nurse-patient ratio is making work conditions unbearable and the moral distress facing nurses daily most agonizing. Along with their patients, residents, and clients, nurses themselves bear the brunt of these deteriorating workplace and healthcare conditions. Over 83% of registered nurses and nurse practitioners, for example, say that their own mental health has deteriorated along with the health conditions. Nearly the same percentage of nurses confess to currently experiencing high to very high stress and or burnout now due to, again, and primarily due to the unrealistic work demands and stress that falls on their shoulders. The longevity of these stressors, accompanied by little to no action on retention and recruitment initiatives to help the situation, is causing New Brunswick's registered nurses and nurse practitioners to lose hope, to grieve the growing chasm between what their training and profession prepared them for and the reality that they face. In short, The situation is depressing. Nurses try to take care of themselves so that they can be there for others, but given the nurse shortage, not only is their much-needed vacation almost impossible to access, 85.33% of nurses say they even have trouble taking entitled and much-needed sick leave. Working short is making nurses feel unsafe at work. They fear for those for whom they seek to provide needed health care and for themselves, even for their licenses. Working short is making nurses feel like they've got nothing left for themselves or for their families. They fear for those consequences. In a chronic state of working short, nurses need rest, but are too often called back or asked to work late because there's no one to take their place. Overtime has increased. In fact, data retrieved from only Horizon and Vitalite health authorities alone, not counting nurses in nursing homes or extramural Ambulance New Brunswick around the province, and in just 6 months, nurses worked over 292,000 hours overtime. That's an equivalent to 97.5 person years. And the situation has likely worsened since the data was collected, with higher numbers of nurses leaving, increased COVID-related hospitalizations, and increased protocols. This report shares many of the exact words spoken by registered nurses and nurse practitioners, words from their hearts and shared vulnerably, anonymously, and confidentially. Most of these need no explanation, but they do beg empathy and action. Here are but a few of their own voices represented. And these are quotes. The anxiety of going to work, knowing that we will not be staffed appropriately to take care of patients. It's constantly feeling like you miss things because it's too busy to do the job properly. I am always worrying about client well-being, safety. We are chronically and critically understaffed. 1 RN is not enough for 60 residents. Feeling chest heaviness while I'm running down through the hallways with pee dribbling down my leg. It's not even a humane job. We are forced to work like this because we are always so short-staffed. My mind and body can't look after itself, let alone the sick and elderly. I can't keep up with the pace anymore. Too little time to do a good job. Management is calling us on our days off, sometimes up to 20 times. We are burnt out. No one has any more to give. I never feel like I am off work. My mind is always thinking of work and how poor the environment is. Hallway nursing is not what I signed up for. We are all feeling the overwhelming weight of the New Brunswick healthcare system crumbling. We are not okay. These experiences are from the testimonies of New Brunswick's registered nurses and nurse practitioners and are reportedly contributing to their increased insomnia, depression, and anxiety, as well as their increased physical illnesses and difficulties sustaining healthy family relationships at home. A whopping 97.64% of the 4,187 nurses completing the survey report feeling not rested at the end of the week. Worse, 89.91% say they are not even rested at the beginning of a new shift. New Brunswick nurses are professionals who care. They are well educated. They sacrifice themselves over and above the call of duty. They are working on the front lines of a crumbling system and too often see more than they wish to see. But they are wearing out, utterly fatigued and burnt out. When asked if they would recommend nursing as a profession to family members or friends, almost 87% said they would not, and nearly 50% said they would leave the profession today in some terms if they could. This is alarming, especially if they were to follow through with their words. None of these findings mean that we ought to give up. To the contrary, They mean that we need to up our game and prioritize retention, recruitment, and well-being for our nurses, and define these actions as urgent. In summary, if there was one takeaway message heard loudly and clearly throughout the whole 1,000 plus pages of data collected, it is that while nurses are tired and burnt out, they too are grieving the very feelings they have and the words they feel obligated to be honest about. Why? Because they care immensely about their profession, about their patients, residents, and clients, and about the healthcare system that New Brunswickers all deserve. Nurses have been asking to be part of the solutions. Their attempts to be heard, however, have been left for too long that the chasm is now more difficult to climb out of. However, the uncharacteristically high response rate in this social research indicates just how strongly nurses want and need to be heard. In the exact words of one, but undoubtedly the sentiments of many, the public would be shocked if they knew how bad things were. Nurses' heartfelt and deeply personal words express that in today's state, they are not okay. But neither do they want to give up. They want and need things to be better. They are crying out for a better model of care. Registered nurses and nurse practitioners bring to the table a solid education, compassionate hearts, and the desire, with what little energy they have left, to be part of a better healthcare system than that of which they are an integral part today. In closing, registered nurses and nurse practitioners have been there for New Brunswickers throughout the labor shortage, increasing demands, and a pandemic. But they are wearing out and they need support. Their too often muted voices may have weakened, but their heartfelt words have spoken loudly in this study, and these call for strong and urgent intervention and investment before it is too late. Nurses deserve better. New Brunswickers deserve better. I'd like to turn it over to the NBNU President, Paula Doucette, now. Thank you.
Thank you, Kathy. As president of the New Brunswick Nurses Union, it's my pleasure. Thank you, Kathy. As president of the New Brunswick Nurses Union, it's my pleasure to be here with Kathy today to share the voices of the registered nurses and nurse practitioners that took part in this survey. First, I want to thank the members. I want to thank the members for the astounding response rate that we received. It was very clear that you were overdue with the respect of being heard, and we want to use this opportunity to elevate your voice and to make it known your professional experiences on the front lines, that you are the backbone of our healthcare system. Second, I do want to make a couple of important points before getting into the heart of the matter. Both of these points relate to the changes that have taken place since the collection of this data. I wanted first to point out that this data is based on responses from registered nurses and nurse practitioners only. At the time of this data collection, New Brunswick Nurses Union did not represent the licensed practical nurses. That only happened after October 8th, 2021. I can only assume, but I'm sure we'll find out shortly as we survey our LPN members in the coming months to find out how they are doing. As well, I also want to point out that Horizons Health Network leadership has changed since the collection of this data. And so any comments within our publication, please take in mind that leadership has changed. Now, to the heart of the matter. It does sound bleak, but it is the reality. New Brunswick nurses are not okay. Nurses are getting to the end of their ropes. However, I must say that nurses are passionate, they're professionals who care about the health care that they deliver to the patients, the residents, and clients every day. People who chose nursing because they have a passion to help. They want to do better for those that they care for. They want to improve the healthcare system in the province that they live in. While this study sought largely much of what was already known, through a CFNU national survey, nurses nationally reported a decline in their mental and physical health in the face of the growing labor shortage that we know is not only here in New Brunswick, but across the globe. New Brunswick nurses are similarly stressed with the unrealistic and unsustainable demands placed on them amid worsening work conditions. The nurses have insufficient time for much needed recuperation because they are working so short-staffed. They are working the 16 and 24-hour shifts. The healthcare system was challenged pre-COVID. And so now that we are 2 years into a pandemic, all of the cracks and breaks in the system are out front and center for everyone to see. It is the degree at which nurses' heartfelt and very personal frontline experiences mirrored one another throughout this province. That was so striking in the data. Indeed, we must face the fact that nurses are not okay, and therefore we have an ethical obligation to act on their words in this report. That includes our obligation to recognize the current healthcare crisis that we are in, and which has had a profound effect on everyone, including nurses. It is every stakeholder in healthcare's responsibility to make working conditions more sustainable, more supportive, and more safe in this province. The lack of retention and recruitment efforts in New Brunswick has meant that nurses' working conditions have become increasingly unbearable. The limit of the level of professional care that they can deliver, despite their best efforts and their personal sacrifices, means that nurses experience moral and ethical dilemmas on a daily basis. They worry about their patients. They worry about their residents. They worry about their clients because they know they deserve better. These strains have resulted in more nurses making choices to move away, to move out of New Brunswick, to take on travel nurse positions, to go to the private sector. In many situations, nurses have left the profession altogether. We know there are over 1,000 nurse vacancies in this province. And if that's not bad enough, the nearly 50% of nurses who report it wishing they had chosen another profession, wishing they could at least reduce their time at work from full-time to part-time, or wishing they could look for a way out altogether. That is alarming. Our nursing and healthcare challenges of today would certainly be exacerbated if any of these things continued to happen. Nurses who today faithfully and sacrificially report to work tired and fearful, talk about not knowing what to expect when they show up, or will they be able to leave at the end of their shift. They are breaking down. They need help, and they need it now. They are extremely burnt out, and the words of several members, our cups are empty. Yet, despite the influx of patients and residents in hospitals and nursing homes across the province, despite the unknown of entering clients' homes, and despite the stress of trying to keep communities safe, nurses push forward one more shift, one more day, one more night. As can be heard repeatedly in this report, nurses can care immensely about what they do, often to the point of their own demise. They cannot, however, keep up this pace. From an outside view, healthcare seems managed, but it's far from the truth. Nurses are not okay. We all just recently participated in the Bell Let's Talk Day. highlighting the importance of one's mental health and talking about this. Since the pandemic, this effort has become more crucial. We can see this is the growing demand for mental health all around us. It should be no different for our nurses either. Nurses' mental and physical health matters. Nurses have been sacrificing themselves to keep our healthcare system afloat long before COVID. They have been undertaking those additional tasks and caring for the influx of patients, clients, and residents. We need to take care of our nurses so that they can take care of us. After all, the healthcare system, it's not a thing or a machine. We often forget that our healthcare system is a collection of human beings, highly skilled, dedicated, and professionals, all struggling to hold it together. New Brunswick nurses, however, cannot continue to be stretched so thin that they must decide daily whether to care for themselves or for their patients, residents, or clients, because both are essential. As many of you may have noticed recently, our second flight of our latest campaign is currently in market. The campaign is titled and asked, "Who needs a nurse?" Well, the answer is simple. We all do. So we all need to start caring about our nurses. No one wants a nurses' exodus from the public health care system because government will not take their pleas to be heard and their pleas for help seriously. Improving nurse retention and recruitment is vital and most critical. Investing in both is essential. Nurses can no longer bear the burdens of years of insufficient investment on upstream wellness, early initiatives, early intervention into the social determinants of health, leaving a population only to get more ill and more ill, leaving our healthcare system in a chronic labor shortage with closures and cancellations and postponements. We know that New Brunswickers deserve more, and we know that inadequate and untimely access to care only creates more problems down the road. As Dr. Rogers mentioned in her opening remarks, revealing social realities often changes social reality. In the case of this study, we want to be clear about what really we seek to change. We do not want to discourage anyone from entering the honorable and rewarding career of nursing. Not at all. In fact, we want to partner with others to help to recruit nursing students and youth to consider nursing as a viable career. Don't let today's challenges rooted in the labor shortage discourage you from considering nursing as a career choice. Instead, I encourage everyone who has a drive and a passion for delivering professional health care to move forward and follow your dream. We want and we need you in the system. The main message we need to deliver from the nurses' experience today is that enough is enough, however. We need to act on it. We need to make significant change. Short-staffed nurses can no longer bear the burden or the brunt of the growing healthcare demands on our shoulders. They need help, and they need help now from all stakeholders. Nurses have spoken from their professional, their informed, and frontline experience of healthcare. They have offered to be at the table for the need of reform. I've been there, and we need to continue to be there. But first and foremost, there must be a real commitment to invest in our public healthcare system. There must be a real commitment to prioritize supporting our nurses so that they can be there for our patients, our residents, and our clients for now, tomorrow, and into the future. We need our nurses, and we need our nurses to be okay. Thank you. I will now open the floor for questions from media. And I believe they can raise their hand, we can see, and then call upon them to unmute and ask their question. I see the first one. Tim Hurd, if you can unmute and ask your question, please.
Yeah, hi, I'm Tim Hurd from Acadia Broadcasting in St. John. You mentioned recruitment and retention. How, with everything that's going on right now, how can we get more people interested in a career in nursing?
Great question, Tim. I wish I had the silver bullet answer to that. It's about having a commitment to invest in healthcare, invest in nursing, to ensure that we continue to maintain a level of experience and expertise in our healthcare system so that we can mentor and be a guide for those that are coming into the healthcare system as nurses. We need to be competitive with other jurisdictions. As many of you know, we have just settled 3 collective agreements that were outstanding for the last 3 years. So although it's not perfect, there is some labor ease, knowing that there are collective agreements in place and that we are working with employers to ensure that all articles are adhered to. It's about an outreach. It's about recruiting and going out at early stages, not only through university programs, but I believe that we need to be outreach to junior high schools and high school students, job fairs, and really showing what the career of nursing can offer to anyone. And I think the other avenue is that we look at international recruitment as well. We know that through the post-education training and labor department, that has been an ongoing issue. So we need to invest, we need to commit, and we need to continue to ensure that we reach out to every possible young person and nurse to potentially think about coming to New Brunswick to work here.
Can I ask one more question?
Sure.
I just, with many nurses leaving the industry altogether, is there a worry that that could escalate even further to the point that patients don't find the help that they need?
Yeah, I'm worried as it is now because, as I mentioned, there's about 1,000 vacancies throughout our system in both long-term care and acute care and community. Nurses have been holding it together by working those 16 and 24-hour shifts, however. That's one thing about nurses, is that we have a lot of care, compassion, and empathy, and we really don't like to see, number one, our patients, clients, or residents going without health care, nor do we like to leave our coworkers let down and working short, although it is a chronically short system right now. I think, it's that circle of where does it start, where does it end? Right? And until we actually put our foot in the wheel to stop it and say, we need to continuously recruit in order to get more people into the system to make it better, I think that's part of the key. The other key, as I mentioned, is trying to retain and keep as many experienced nurses within the system to be supportive of those coming in as well.
That's great. Thank you so much.
Thanks, Tim. Next I have CBC.
It's Mernali.
Yeah, sorry. Yes.
No problem. Good morning.
Good morning.
The report makes reference to a culture of acceptance, and I'm just wondering if you can elaborate on what this culture of acceptance is and what are the institutions that are upholding it?
Well, as a predominantly female profession, I think over the years that nursing has more or less just followed the rules. They've never pushed back. They've never stood up for themselves. And I think that is part of the problem that we're seeing today. But however, nurses are finding their voice to say enough is enough. So I think that might be part of the problem. And I don't know if Kathy, if there was anything in the report that maybe you could add to that.
Paula, I think you hit the nail on the head in one way, because we did hear several voices say, if this was not a predominantly female occupation, would things have gotten this bad, or would it have taken this long to prioritize the supports and need for more nurses and to take care of the nurses that we have already? So it's in their minds as well, and they did express that. But also just the fact that they have expressed feeling like they are working in unsafe conditions and things aren't changing. And when they say unsafe, they don't just mean for themselves, they mean for their patients or residents. And so they just also want to see change because they care about the work they do.
Thank you, Kathy.
And would you be able to elaborate further on the aspects of patient care that are suffering or will suffer further because nurses are unable to do their job safely?
Well, right now, nurses are doing everything within their power to maintain some level of care to their patients, clients, and residents. That goes without saying. And I think I mentioned that it's sometimes to their own detriment, that, they go without their breaks, they go without their lunches, they do the extra hours, they work the overtime to ensure that there is good quality health care being delivered. The question is, and what plays on nurses' minds is they know that they could be doing more. They could be doing more teaching. They could be doing more explanations to patients. I'll use the example of a newly diagnosed diabetic and sitting and really teaching them to understand their disease and what, affects poor food choices might have or sedentary lifestyles may have, and how to make good choices going forward. They don't have the time to do that. So what happens to that newly diagnosed diabetic is they get discharged from hospital with only half the education that they should have received, and a few weeks later they're showing up either at their doctor's office or the emergency department in a diabetic crisis. Nurses see that every day. So that's the kind of care that's being compromised. About the care from the day to day, yes, they're struggling, but we have to prioritize, who requires care immediately. And we're getting away with, a lick and a promise in many aspects of other avenues of healthcare. That's why I think reform is important, and that's why I think elevating the voices of the nurses today in this report and this data that we've collected will be very paramount in any changes going forward of how do we deliver healthcare in this province.
May I ask one more question and then that's the last one?
Sure.
So one figure in the report was 37.44% of nurses say they're not having access to training and education, which is discouraging. So would we be able to hear more about the gaps in education and training that is being referred to here?
So a lot of times there is, mandatory training and education. There's also other education and training that nurses would like to take to help support the roles that they play within the healthcare system, whether it's surgical education, it could be medical, palliative care, emergency, ICU, whatnot. There's no time. There's no time for them to take these educationals, and there's no replacement for them to take these educationals. And nursing is one of these professions that continues to evolve with data research, the new and upcoming procedures, techniques, treatments. There's all kinds of reading and new things that we have to keep on top of. And they're struggling with the amount of time it takes because they don't have the time to keep up to date with the latest research and data that's out there.
Okay, thank you very much.
Thank you for your questions. Natalie Sturgeon?
Thanks, Paula. I sort of, when we heard about the healthcare plan that the government rolled out, it didn't specifically address recruitment and retention. And I'm sensing that some of the struggle we're seeing here is staffing shortage, which is then compounded by other issues as we get down the line. So realistically, what should the government be looking at in terms of helping get that recruitment and retention aspect in there to help with those other issues?
Yeah, thank you, Natalie. That's a good question. I wish, that we have a solid commitment on investing in recruiting and retaining our nurses. I think that's where we really need to focus on. I'll go back 20 some years now. I think it's 22 years ago this year that we no longer had the schools of nursing in the province of New Brunswick. It was a BN entry to practice, and we lost significant number of nursing seats across this province that were never taken up by the universities. The capacity wasn't there. So in order to really be effective in maintaining a level of graduates coming out, we need to invest in making sure that we have enough university seats available and the ability for those that want to take the courses and take nursing as a career, that it's there. That's the recruitment piece in that aspect of the education. We need to be competitive with other jurisdictions. And as I mentioned, we've just recently concluded 3 collective agreements with our long-term care, our hospital nurses, and our nurse managers and supervisors. I mean, it wasn't overwhelmingly accepted. And why is that? It's because nurses are tired. But we need to be competitive. We need to keep up to date with what's going on around us. And again, the other piece is about retention. You know, we need to be respectful of the years of service that nurses have given to healthcare in New Brunswick and the experience that they bring. Hands-on experience is second to none in sharing, you know, the profession with those that are just coming in. And so we need to figure out a way to enable those that have been showing up every day and working short for many, many years to be more supportive and allow them to pass on their experience to new nurses.
Just one more question. Yesterday, the budget dropped with a significant surplus. I'm wondering if you were surprised by that and what you want to see, even though they say they're not going to be doing any spending.
Well, I was surprised with the amount that has come up as a surplus here in New Brunswick. And then I was really surprised that it was attributed to the federal transfer monies. What I can say is that New Brunswick has to step up. And when I say that, they need to step up and recognize the work that healthcare workers have done throughout this pandemic. Many other jurisdictions have recognized frontline workers one way or another, whether it be with monetary incentives, days off, recognition of some sort for the work that they've done to get their provinces through this pandemic. And so when I see a surplus such as that, there needs to be a serious investment into the frontline workers right now in healthcare, not only in healthcare, and I'm only speaking about healthcare, but we need to look at what do we need to do to invest within our province to be able to continue to be viable, to be able to be a jurisdiction that others would be willing to come, set up shop, move here, work here, invest here, spend their money here. I think governments really need to take a hard look at investing back into our province and the people that have been keeping it afloat for so long. Simon?
Good morning, Paula.
Bonjour.
Bonjour. Could you give us the highlights of the collective agreements that have been signed recently? Yes, are you satisfied about those new agreements? And can you give us some details about wage increases, for example?
Thanks for the question, Simon. I think it takes away from the report that we're presenting today. What I will say about the collective agreements is that now they are accessible online on our website, and it does talk about we have managed to get wage increases so that we're no longer the lowest paid nurses in Canada. It's still a step in the right direction. However, there's still much work to be done. I will talk about and positively, which may not affect the workloads right away, and we may not see the changes right away, but there is a serious commitment to look at nurse-patient ratios in this province. We fought long and hard to have that. We're the first province in Canada to actually get some meaningful language around nurse-patient ratios. We know that it works in other jurisdictions such as New South Wales, Australia, and California. It was tried in Quebec, but it wasn't successful. But we are concerned and we're pleased here that there is a commitment to actually look at nurse-patient ratios. We also know that there's been some new language around looking at our long-term disability plan and our pension plans to ensure that they are feasible going forward, that they are economical, and that they are there to support our nurses. So again, Simon, thank you for that question around the collective agreement, but I'd like to kind of keep in the stream of the data that we are releasing today about our nurses not being okay.
Maybe a last question. The report mentioned nurses leaving the public sector, and recently we've seen more nurse practitioner turning to private organizations like eVisit New Brunswick, for example. Do you have any concerns related to that?
I think any time that somebody leaves the public system, whether it's a registered nurse, licensed practical nurse, nurse practitioner, I think that does take away from the system that we all hold near and dear to our heart. I believe that a significant and serious investment in the public system would then enable those that choose to leave maybe have a second thought. So anytime that we do lose in our public sector, we all feel it. The wait times increase, the delays are there, and then it creates a two-tiered system of those that can afford to pay may access care quicker than those that can't.
Merci.
Thank you. Andrew?
Yeah, good morning. First of all, can someone talk me through, perhaps Ms. Rogers, the methodology used for the survey? I just kind of want to get the parameters of that, if that's okay.
Sure. Thank you for the question. The survey was sent out in June. The data was collected and analyzed in July and August, and then the report written in the fall. It was a combination of quantitative and qualitative data that was collected. So, the main question we wanted to have an answer to was, how are you doing? And we asked the question a multitude of different ways. So we asked about how's your mental health, how's your physical health. Some questions required a rating scale, 1 to 5. Other questions required box checks. But in almost all questions, there was an opportunity to add narrative, and that's why we end up with over 1,000 pages of data. Because nurses, first of all, we had a very, very high return rate according to, industry standards and social research. Remember, the LPNs weren't with the NBNU at the time, so just nurses and nurse practitioners having over 4,000 responses to the survey, and many of them wrote quite long narratives to describe examples or to explain the answer to their question. For example, do you feel your mental health is deteriorating? In what ways? And then in another part of the survey, we would look at, where do you root this? What do you think are the main causes? And we also wanted to assess where the problems lie. And, I would have to say, if we cross answers, we come to a real root issue of nurse patient, nurse client, nurse resident shortage. So the ratio is leaving them feeling like they can't do their jobs well. They feel unsafe. They carry the stress home with them. And the questions were tested in a multitude of different ways. But that's why we have a combination of statistics. And I should say as well, we didn't talk about it today, but the report includes also some data that was collected from a poll we did, a telephone poll to New Brunswickers. 400 New Brunswickers replied, and we wanted to know what New Brunswickers expected of the healthcare system and what New Brunswickers thought about nurses, what kind of work nurses were doing. And so that was combined in this report as well.
Okay, thanks for that answer. Paula, obviously since this report came out, the government's embarked on massive health reform. So, I kind of want to get an idea of how that's going so far from the MBNU's perspective, what your members are telling you about that engagement process, if there has been any engagement to date. Thanks.
Thanks, Andrew. So, leading up to the healthcare reform announcement, there were the community engagements, there were stakeholder engagements. We encouraged our members to participate within their communities when Minister Shepherd was going around virtually to different parts of the province. The healthcare reform it's broad, and so some of the changes that we are slowly starting to see is not affecting the front line per se. So in all honesty, nurses are saying, yeah, there might be a healthcare reform document out there, there might be some grand ideas, but it's not affecting the way that I show up and do my work every day in the public healthcare system. So that leads me to believe that there's not been enough thought that goes into how do we make changes at one level that can then trickle down to affect the front line of healthcare in this province. So timely that we report that nurses are not okay. One thing that I have often and will continue to say is that we're willing to continue to work on trying to come up with strategies, ideas, different ways of doing things that can better support the frontline staff, nurses and other healthcare providers included. And I think that's going to be key moving forward after today, is that when stakeholders and decision makers really look at this report and all the data that's in there, that they don't turn a blind eye to it. I'm hoping that following this publication distribution to key stakeholders, that I can have meaningful conversations and have a meeting to discuss what possible go-forward pathways might be to affect change positively for frontline staff.
And just one final question. It seems, and please correct me if I'm wrong, but the central solution here that the MBNU is looking at involves recruiting and retaining. Now, the Premier has made it very clear that he doesn't think that just adding more and more people is going to necessarily be the answer, and notes that, shortages in fields like nursing are worldwide. So, why, first of all, am I correct in that read? And second of all, if we are talking about a worldwide shortage and a Premier that doesn't seem particularly interested in that being the solution, where do we kind of go from here?
I continue to push, because we're never going to get out of the mess that we're in unless we have true commitment into recruitment and retaining, as I mentioned different times, the experienced nurse in our system. So that is something I won't back down on, because I truly believe, based on the data that we've had even before this survey, that 46% of our workforce is eligible to retire within the next 5 years. We, as I said, COVID has put a spotlight on the healthcare system that we cannot continue to turn a blind eye. We cannot continue to say it's like this everywhere. We need to be innovative and thinking outside the box in ways to attract people to consider nursing as a viable career. We also need to make serious investment into spaces and placements for those nurses coming into the system, and also again to keep those with the experience there to be mentoring and buddying and helping out and guiding those new nurses. So I'm going to continue to push recruitment and retention, because I think that is the only way out of the problem that we're in today.
Thank you.
Thank you, Andrew. I've just been advised we have a hard stop at 12 o'clock. So we've got about 11 minutes left. I've got 3 questions. So if you can keep your questions concise, I'll try to get to them as quickly as possible, but I do apologize. We have to stop at 12. So Pascal, please.
Oui, bonjour, vous m'entendez?
Yes, can you hear me? I would like to have an answer in French, either from Madame Rogers or Madame Doucette. I would like to know, what are you asking as change, a complete change? What are you hoping that this report will what will it bring about as changes concretely?
Merci, Pascal. Désolé, on est.
I'm sorry. French is not my first language. It's not the first language of Madame Rogers neither, and that's why we hired simultaneous translators.
Apologize.
Madame Doucette, je suis désolé, à la télévision en français, ça me prendrait des clips en français. Donc, si vous, Madame Rogers, pouvez répondre en français, même si c'est pas parfait, ce serait très apprécié.
Even if it's not perfect, it's okay.
Well, to get into the technicality of my answer, I would not be able to do that in French, and I don't know if Kathy
It's
feels.
just that, just to be clear, I can't use
Okay.
translation in the TV broadcast. So even if it's just a very simple and short answer, I'd appreciate it if I could get something in French. Thank you.
J'espère qu'après aujourd'hui,
I hope that after today, we'll have commitments and meetings with the people in government, employers, all of our stakeholders in public health to talk about ideas and possibilities to take ideas
shortage of nurses pour des pénuries de.
to help us with the shortages in nursing, and also to increase the voices of our members to say we're not okay today.
Poser leurs questions, je pense qu'il y a.
Thank you. I'll leave the others ask their questions. Thank you, Laura.
Hi there, can you hear me?
I can barely hear you.
Okay, well, I'll be quick. Most of my questions have been answered, but there's a statistic in there talking about US nurses and them considering leaving their current position. I'm wondering, do we have any numbers for what people may be considering in New Brunswick? You know, the number of nurses potentially looking at leaving the profession.
Yeah, I'll ask Kathy.
Hi, Laura. Really, we had a very high response rate in this survey, and the direct question was asked, both, would you recommend this profession to friends or family? Why and why not? And if you could leave your job today, would you do so? Why or why not? And answers came back in a way that is quite frightening, and it parallels the national study by the CFNU. Almost 50%, 47.48% of nurses said that they would leave their jobs now if they could financially afford to do so, or they're currently looking for alternatives, or they already have an exit strategy in place. Now, that's a huge percentage. And you have to remember, they're in a position of being very stressed right now, burnt out, worn out. And so this is the voice and the perspective from which they're speaking. If they were to follow through on this, it would be alarming. Paula already mentioned that, 46%, I think it was, of the workforce is eligible to retire in the next few years. So we have lots of reasons to be concerned and to prioritize the investment in recruitment and retention.
And I'll take Erica.
Hi there.
Hi, Erica.
Just a quick question. You touched on this already, Paula, but I'm curious as to what we need to be doing as a province in the education and training front. And you mentioned seats opening up. We have a $500 million surplus coming our way, at least projected to. What kind of investments can we be making in getting more people educated and trained as LPNs and RNs? What needs to happen there? Because I haven't seen in this whole health reform thing, I haven't seen any changes on that front. And it seems to me that recruitment is one thing, but supply is sort of another.
Yeah, absolutely. And thanks for your question, Erica. As I mentioned, it's 22 years since it's been BN entry to practice for registered nurses in this province, and we lost all of our nursing schools throughout the province. We need to ensure that we have not only the appropriate number of seats, but we need to ensure that we have instructors and the right clinical spaces available for our students that may be considering BN as a career choice in our community colleges. Do we have enough supports in place there? Are there courses being offered in not only our urban centers but some of our rural centers as well? And I think we need to really look at what is out there, what's available, and how can we invest seriously into ensuring that we have enough seats, instructors, clinical placements, and supports in place for all of those avenues. And I think for many years we've not done that. And so we know we have UNB and we have UDM here in our province for the BN program and onwards to nurse practitioner. We know that our community college, NBCC and CCMB are offering for our licensed practical nurse programs, but do we have enough being offered everywhere? We've just recently seen an increase in the seats to the bridging program. So licensed practical nurses, could go on to study to become a registered nurse. But we know that there's still some barriers in place. It's only available to those that have been educated as licensed practical nurses here in the province that are enabled or eligible to even consider that bridging program. I think we need to open that up beyond our borders of just New Brunswick. If there's licensed practical nurses that have made a choice to come to New Brunswick and work here and they now want to become a registered nurse, we need to open up that availability for them to access bridging as well. So I think, we really need to look at what is out there and how can we increase the availability of educational opportunities. And I think I made a comment early on that we do need to do an outreach and start at the junior high level, really talking about what nursing is and all the domains that nursing, you will find a nurse. And right away, when people think of nursing, they think hospital, but there are so many other doors open for nursing in this province and across all jurisdictions that we really need to be highlighting the fact that nursing is a great career. I just want to say that, as we close off here today, that despite the negative tone that many may think that this report depicts, nursing is still a great career, and there's many of us. I'm very fortunate to represent almost 9,000 nurses, licensed practical nurses, registered nurses, and nurse practitioners in this province that continue to show up every day and love what they do. What they're saying is we need help. So I'm hoping that New Brunswickers, government, employers, and all stakeholders in healthcare really listen to what the nurses have to say and say that we are willing to help and we will get down to business of trying to make your workplaces better. With that, I've got 2 minutes left, and I'd like to say thank you very much to the media for your questions. I'd like to thank anybody that has listened in today on our platform as we release this very important information of the voices of nurses in this province. And I want to thank Dr. Kathy Rogers for the work that she's put in to putting this publication together, and it will be accessible on our website following today. Thank you, everyone.